My name is Joshua Austin, and I'm a dentist here in San Antonio, Texas. And dental implants are a great way to replace missing or broken fractured teeth that are not restorable. It's really the best way that we have to replace a tooth that is either irrestorable or missing. Basically replicates the tooth root out of titanium, and then it gives us the ability to restore that implant in order to bring you back to the full function that you had before. In our practice, we take an approach of pragmatism with our dental implants. We want our patients to be comfortable and be able to chew what they want to chew and be able to eat the foods that they want to eat. We want them also to be comfortable with their smile so they don't have self-conscious moments or moments of feeling like people are judging them for maybe some of the teeth that have been missing or broken. And so we want to make sure that we restore people well with implants that need them for those types of situations. And if we feel that may be you, please let us know. And we'd love to see you for a consultation to visit with you about replacing teeth with dental implants. The process for dental implants can be long and it does have a lot of steps, but we can help you through it. It starts with a consultation and some imaging, both radiographic imaging and a 3D intraoral scan. From there, we digitally plan the placement of your implants and software. Where is the implant going to go? Where is the restoration going to go when the implant is in and ready? And we make a 3D printed implant guide. That implant guide will snap onto your teeth during the implant placement and basically allows us to make sure that we get the implant in the perfect position to restore the situation. The implant needs to heal for a few weeks, usually about 12 weeks. After the implant is healed, then it is time for us to do our restoration on it. That takes anywhere between 2 weeks and 1 month. After that is done, then we're done. The tooth is replaced, and you are back to full smiles and full chewing with your brand new, sparkling, pretty dental implant. In order to evaluate if you're a good candidate for dental implants, we start with a few records. First one is a radiograph, specifically a 3D radiograph, what's called a cone beam CAT scan radiograph. That gives us a really nice 3D image of your gums and your bone to let us know where all of the important anatomy is and if we have the space that we need to place a dental implant, and if so, what size of dental implant. The second piece of technology we use is a 3D intraoral scan. It basically gives us a very precise map of all your teeth and your gums and where they all go. And by using those two pieces of data together in 3D planning software, we can virtually do the surgery of your implant, figure out where everything is going to go in order to give us the outcome that we desire. So we basically start by doing all of the steps virtually on software so that we don't find any surprises when we get into the actual surgical placement of the implant later on down the road. It eliminates surprises and makes things more predictable. During the healing phase after a dental implant is placed, the most important thing is to practice good oral hygiene. We want to make sure that we keep the area clean, free of plaque, free of food debris, those types of things, so that the area can heal really well. Apart from that, it's really just a process of letting Mother Nature take its course, and that will get us ready for the next phase of our implant care. But it all starts by controlling plaque, making sure that the area is clean of food debris, bacteria, all the things that can cause us problems later on. If we do those things, 99% of the time, things go very well. Implant technology has changed a tremendous amount over the last few years. The ability for us to take digital 3D records, like a 3D radiograph, a cone beam CAT scan, and a 3D intraoral scan, and using those pieces of data to virtually do your implant surgery before we ever start on the actual patient helps us eliminate surprises, helps us eliminate and see ahead of time any problems that may occur. That's made our results more predictable. It's made the process safer for patients and easier to recover from for patients because it inflicts less trauma than our old ways of doing it, which was basically just start the surgery and see what happens. We are much more predictable now because of the digital software, and it's enabled us to make the process much more seamless, less painful, and totally overall more enjoyable for all of our patients. Dental implants are a great option to restore one tooth that may be missing, but they're also a great way and they can be used to replace multiple teeth. So many times we will use two implants and that can replace two, three, four teeth sometimes by doing a different type of prosthetic on it. And in some situations, we can replace an entire arch of teeth with as few as four implants. So one implant to replace one tooth is great. And sometimes we can use just a couple of implants to replace many teeth, and that's great as well. If you wanted to find out more about those types of options, all we need to do is do some imaging with radiographic imaging and with 3D scanning technology, and we can give you a plan that will show you what we need to do to replace those problem teeth or those missing teeth that you may have. While dental implants are great for patients who have had issues before, like gum disease and cavities, they can still have some problems as well postoperatively, and we need to maintain them just like we would our normal teeth. The good news is it's not that much different than maintaining the teeth that were there before. We need to do some brushing, we need to do some flossing, maybe some water picking, but we generally care for our implants almost exactly the same way as we would care for the teeth that were there before them. Sure, an implant cannot get decay on it. That is true. But you can still get gum disease. You can still get infections and things like that around implants. And good plaque control at home, good oral hygiene at home, good home care will really help to minimize those types of situations so that the implant lasts as long as it can, which can be for many, many, many years and decades. If you're interested in dental implants and finding out if they're right for you, the best way is to schedule a consultation at our office. You can give us a call or you can visit our website and request for an appointment on there. You can even send us a message on Instagram, and we'd be happy to get you all set up with your consultation appointment with myself or one of the other doctors here at our practice.